Cam, we're going to tackle first our approach to resolving a food bolus, a food impaction in the esophagus prior to endoscopy. And before we get into the article, how do you approach this patient?
This is such a funny and germane topic because, we're trying to pick things that are a little bit festive, but they're also applicable to day-to-day practice. So this is something you see not only on the holidays, but year round. When I moved from California to the Midwest, I think I increased my exposure to this pathology by like an order of magnitude because people eat really rapidly in the Midwest and they plug up the old food tube. So to answer your question, Drew, I've been fascinated by the disparate approaches to this regionally. At one point in my career, it was just wait a few hours, see what happens, and then if it's still there, GI will begrudgingly come in and perform endoscopy. At another point in my career, there was like various potions and tinctures the nurse would mix up, and it was almost always cola-based, right? This idea that you're going to use carbonation to pop it out. And most recently, the GI team that I work with prefers, some putative commercial product that does the same thing. It's like a powder packet you throw in and it makes a whole bunch of gas and supposedly helps. And I guess I assumed that these carbonated products worked, but what do you have to tell me, Drew?
Well, so the one you didn't mention that I have been asked many, many times for is glucagon. Have you given them glucagon before I come in and scope this patient by the GI physician? That's not been the regional preference in any of your shops?
I've definitely been told to give glucagon. It's really just like an emetogenic at that point, right? You're like trying to make somebody puke. So you're using the adverse effect of glucagon, hoping that it'll clear it out. Patients despise it. It's also pretty costly, and so I've dispensed with glucagon myself.
Yeah, I have too. Under the guise of being a smooth muscle relaxant, what we actually do is induce emesis and hope that it just comes up. But that comes with a whole slew of issues. Also, to be fair, I think the thing that I have reverted to is the tincture of time. I kind of watch a patient for a little while. If they want to try drinking something, I could care less what it is that they drink. I will often offer them a soda of some type, and that has carbonation. I am not convinced at all that the certain type is beneficial, other than maybe the carbonation is a little bit soothing, allows you to relax a little bit, potentially tickles the throat in the areas that have been irritated. In my dream of dreams, I think that the bubbles lift up whatever item it is that is stuck and cure it of the impaction, although I know that is hogwash. And then if that doesn't work after a little while, and mind you, what I know that I'm doing is just time, not actually intervention, I call GI. But there is a lot of dogma around the fact that soda might actually help. In fact, there's been some retrospective studies that have told us in greater than 50%, in some even up to 100%, will get passage of food impaction using soda. But finally, we have a randomized controlled trial to tell us whether it is or isn't. So it is Tibby et al., and they are talking about the efficacy of cola ingestion for esophageal food bolus impaction. It is an open label, multi-center, randomized controlled trial from the BMJ. This was December of last year, and I've had this hidden in my folders to talk about this year so that we can make sure we cover it in time for the holidays. And this is a very simple, I don't want to say ingenious, but very appropriate study to determine, number one, does cola, in this case specifically, they used Coca-Cola more often than not, help, but also is it safe for patients with esophageal food impactions? Now, a couple rules of engagement for this study, which is that, first of all, it had to be a soft food impaction. It could not be a piece of bone or some other hard item that was impacted and stuck in the patient. Second of all, the patient could not have undergone any other acute intervention. Previously tried cola, glucagon, some other commercial products, something that would have helped to pass it. So it's either you have something stuck and you have done nothing and it is soft. These are essentially the rules of the road for the patients that we're going to try this on. And then, of course, the standard has to be 18 years of older because this is not a pediatric trial. And they did a whopping 51 patients meeting criteria after exclusion and all that. But you know what? For something like this, that's not bad. It gives us a good number. So we have 23 to the control group, and that is truly just nothing. tincture of time, and 28 to the treatment arm receiving this cola product. The most common food boluses were meat, which is specifically why we're covering this on the holiday edition when people are off eating turkeys and hams and beautifully dry aged crusted prime ribs. My mouth is salivating just thinking about this. So most commonly meat. And then interestingly in this study, part of it because of where it was performed out of, but fries, sauerkraut, and bread were the next most common stuck items. And I am just baffled by the fact that sauerkraut has become an impaction. Cam, what's your take on that?
I don't know. I feel like the cabbage is a little bit difficult to digest. It kind of goes down slowly. I'm not too surprised. Yeah, I think we'll all have our regional variations. For those of you who want to jump on the website and leave in the comments, like, what's the commonest thing you see? Certainly in my practice, it has been meat, but oftentimes it's like, some potpourri of meat and a bunch of starchy stuff. So yeah, not too surprised. This sounds representative.
Yeah, so the study is coming out of performed by a Dutch hospital. So sauerkraut is certainly part of that food more so than maybe in most places of the U.S. unless you're hailing from Cam's old Minnesota or Wisconsin, where I used to visit frequently when I was a Northern Illinoisan or Chicagoan, as one might say. But let's talk about what this study gets you. So in the cola group, we had complete food bolus passage in 12 of the patients. That is 43%, and it occurred within 45 minutes of giving this in the ED. Partial food bolus passage, which I'm unclear exactly what that means for most patients, in 5, so 18%. So greater than 50% had either passage or movement of the food, which is what I think we can put in the partial passage category. And in the control group, complete food bolus passage occurred in 8 of the patients, 35%, and that was 40 minutes of being in the emergency department. And they also had a partial passage rate of 26%. Both groups with no passage were observed, and then endoscopy to confirm complete esophageal impaction and passage in that. Now, interestingly, Cam, I'm sure is no shock, in the control group, there was no adverse events, but also in the intervention arm with cola, there were no adverse events, although 6 patients, 21% in the treatment group, did have some abdominal discomfort following cola administration. I am not sure that is in fact relative or not, or if it's just some bizarre association in this situation. During endoscopy, for those that had to go, there were, again, no adverse events for the endoscopy group. And this is an invasive procedure, so it's good to hear that there's nothing adverse happening there. Although 4 patients had some type of mucosal lesion identified, 1 with some minor bleeding, and it's unclear directly if that was the food bolus or endoscopy, although I would honestly lead food bolus over endoscopy in those situations, as upper endoscopy is actually a very well-tolerated procedure overall. So what to make of this? It didn't seem like it helped passage, but it certainly didn't hurt passage either. There's not a statistical significance to this. Yes, the percentage was a little bit higher in the cola group. Cam, what are you going to do with this information next time you have a food bolus impaction?
I guess I'll just stay the course. I'll continue doing whatever the regional norm is, as long as it's not giving an expensive, potentially toxic drug like glucagon. Candidly, I would say no to that. I found probably the most interesting part of this study, the methodologic diagnosis. And so this is actually non-trivial. How do you confirm somebody has an esophageal food impaction? Ideally, you perform endoscopy to make the diagnosis. In this case, their inclusion criteria was pretty awesome. It was tachyphagia plus the inability to swallow saliva. And we're being a little bit jokey about this, but that is an important thing to bear in mind. So when you're getting your history of somebody who you are suspecting of having this pathology, you're really looking for 2 things. 1, they're eating very rapidly. That's tachyphagia. And 2, you think it's a complete obstruction because they can't swallow saliva. And so that was, for me, the crystallizing feature of this paper. I think the analysis is cute. I don't think it necessarily changes practice.
Yeah, so at the end of the day, with some discharge instructions, because even if these patients go to endoscopy, at least in the hospital that I work, they come back to the ED once they have partially recovered and I discharge them, because they're not being admitted to the hospital and the GI docs don't want to do the discharge themselves. That is fine. I have no qualms whatsoever with that. But it's some good instructions, you need to actually chew your food, which is why in my local practice, I actually see this more often in the poultry meats as opposed to the red meats, because red meats often require more chewing. It's hard to have that tachyphagia with true red meats, where it's a little bit easier in poultry products to have that. Although, again, that is anecdotal and just in the Midwest where I am practicing. So at the end of the day, here's where I actually have a little bit of advice based on this paper. If it is a complete food impaction, they cannot swallow secretions, I'm going to pick up the phone and I'm going to call GI. In the meantime, might I try a little bit of something to help them out? Sure, and a soda seems completely reasonable. If it's only a partial food impaction, that's actually where I might go towards something more like, why don't we try drinking some cola and see if that doesn't pass things along, knowing that it doesn't have an adverse effect. And maybe in that situation, and this is again anecdotal, but it might be helpful. But if you can't swallow your saliva, get endoscopy.